All right, you guys, no consults today in person, but did want to just show you briefly how we would go over a consult when we do open up for consults and what it looks like, so that you guys won't feel maybe as apprehensive, or you might just be able to answer any questions that you guys have. And so generally, let's talk today about a tummy tuck. If a person comes in, whether it's a male or female, we have them fill out some initial brief information that goes over their medical history. Then I come in and see them along with my staff member, and we go through just kind of first of all, is what their goals are for having a tummy tuck. And so that might be to get rid of some skin that's loose. That might be to tighten up a large diastasis and get rid of loose skin. That might be to have some liposuction as well. So that's the first thing we do, is kind of get an idea of what they're at, where they're at. If they're a female, then we ask them about their history of childbirth and kind of go through on their recent pregnancies, whether it was, or even if it was pregnancies were a long time ago, but we go over all their pregnancies. Did they have C-sections? Were there vaginal deliveries? And discuss all that. We go over their recent weight changes over the last few years and kind of decide whether or not their current weight is at a good weight, or if we recommend that they should lose some weight prior to the surgery. And we discuss all that with them. After kind of going over those brief things, we then do an exam. I have a staff member with me here, and we quickly just do an exam of the tummy area, the back area, the flanks, and go through just kind of the areas where they feel is problematic for them. For example, a lady that we had seen today for a post-op visit where we did surgery last week, she did not want to have any fat transfer to her buttocks, where she just wanted to have lipo on the back area. And so we go through all those questions with you, because some patients do want fat transfer. Some patients don't want fat transfer. Some patients are, everyone's different. And so we just make sure we understand exactly what the patient's looking for. And then we do go over, kind of what we think, just given our experience, is the best thing for the patient. For example, if a patient says, I want fat transfer, but they really don't have a lot of fat, I'm going to tell them that really, fat transfer is not going to do anything for you, because you really don't have a lot of fat for a liposuction to have a fat transfer when we do your tummy tuck. So there's all those different things that we kind of go over with the patient. We then make sure that that they clearly understand what the procedure is like on the day of the surgery. So I go through and I talk through them all about what the procedure is like from the time that they get here to the time that they leave, and go through that whole transition with them. Explain to them what to expect afterwards. We go through what are they doing as far as their occupation. Are they working at home? Are they, exactly what are they doing, so that they clearly understand after the surgery is done what their limitations are, or what they can be doing. So that's super, super important. I like to individualize that for every single patient, so that they clearly understand kind of how much time that they need to take off, when they can start getting back to the gym, if they've been exercising, all those different things. We clearly discuss that with the patient at that visit. We then go over just kind of our typical post-op follow-up visits and kind of what we're looking at, and explain to them that we see them after a tummy tuck. We see them the day after the surgery. We see them a week after the surgery. We see them 2 weeks after the surgery. We see them at 4 weeks after the surgery. And we see them any other times that they want to be seen. So we go through all of that with them as well. So by the time that they leave here, or the time that you look for, a year, but based on the time of the year and our availability, that's going to generally be for at least the next 3 months, but often the next 6 months, that will guarantee you that price for this surgery. We have care credit available for financing options, and we can go through all of that with you. My front desk staff can go through all of that with you as well. If you don't have the money all at once, but you want to pay it over a 6-month, 12-month period of time, there's different financing options that are available. So anyways, those are kind of the things that we do in a tummy tuck consultation with you. And if there's any questions you guys have, feel free to ask us, and we can get back to you. You can schedule, like I said, virtual consults at any time. Surgeon did it just randomly happens, and it's completely out of the control of the surgeon, or it can be sometimes I iatrogenic, meaning that the physician had something to do with it. And that would be most obviously avoided if there's a lot of liposuction that's done in a certain area on the tummy that gives good blood flow to the incision. And so if a lady comes in and that she's obese, I'm going to explain to her that I'm not going to do a lot of liposuction in the upper abdominal area that feeds where the incision's healing, because there can be an increased risk of the area developing necrosis. And that's basically meaning that the incision doesn't heal well and the skin dies and the tissue underneath the skin dies. We want to do absolutely everything to avoid that. Again, very, very rare, but something that you want to have a discussion with the patient. So that's generally what we do. And then I ask them at the end, what questions do you have? We go here. If you decide to come in with a consultation for us, you clearly understand kind of what the process is, what to expect, what the healing's like. We also go through the risks as well. That's a very important thing that I like to discuss with the patients, to make sure that they clearly understand the risks of a tummy tuck. The two main ones that I talk to the patients about all the time is the risk of a deep vein thrombosis or pulmonary embolism. That's a blood clot in the legs that can end up going to the heart. Is very rare after a tummy tuck, but it can happen. So we go through all the things that they need to know to prevent that. And those things such as making sure that they're walking early on afterwards, me possibly starting them on a little blood thinner after the surgery if they're at higher risk. All those things are discussed. And then also the incision healing, and discussing with them something called incision or wound necrosis that can develop. And that generally can develop. Sometimes it's nothing that the doctor did or nothing that through all the questions that patient might have. So it's a very long, basically, I see it almost as an interview for me, and the patient's interviewing me and my staff as far as whether or not this is something that they want to do, and whether or not they feel comfortable with us, whether or not they feel like we're going to be able to provide the service that they desire. And so we go through all of those things with them. And then at the very end, we give them a price quote.